This study has actually been reported 2 or 3 times at ASCO now, and it's a study comparing the use of Olaparib after chemotherapy to the use of placebo after chemotherapy. And the reason why placebo is acceptable is that standardly you don't give anything usually after chemotherapy. And it's already been shown that the Olaparib improves the time until the cancer gets worse or comes back in patients with ovarian cancer. The subject of the presentation this year was really looking at whether it affected survival. And what this data suggests is that in the patients in the study, the risk of death was 27% less if they got Olaparib. And if they had a mutation in either the BRCA1 or BRCA2 gene, then it seemed that the risk of death was 38% less if they got Olaparib. So that was quite exciting. But perhaps the main take-home message for me as an oncologist, and in terms of thinking about getting hold of this drug for my patients, was that there seems to be a group of maybe 10 or 15% of patients who remain on the drug well 5 years into treatment. And for relapsed ovarian cancer, that really is something very new. So we call these patients super responders, but we don't really know what exactly makes somebody a super responder, and we're working on that, but that is one of the very exciting things. Other important things that came out of the study is that because there's now been a lot of follow-up, many years of follow-up, we now know a bit more about the safety of the drug, and it appears that there are no new issues that arise out of giving this drug for 5, 6, 7 years. So that also is reassuring.